good afternoon, good evening. I extend a warm welcome to all people who are joining us in this webinar number 149, organized by the Andean Health Organization Hipólito Unanue Agreement. This cycle of webinars started in May 2020. This year, we're celebrating 50 years of Horas Konu, a very sensitive and significant anniversary due to the difficult time we're going through. However, as a reference in health in the region, we continue uninterruptedly the joint and coordinated actions with the 6 member countries, Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela, thus fulfilling the goals and objectives to strengthen the health of our people. As a reference in health, we highlight 3 aspects. Contribute to reduce the vaccination gaps, especially in view of the alarming situation regarding the reemergence of polio cases in the world. We urgently need to reinforce immunization campaigns so that the population can adequately comply with the vaccination schedule in each of their countries. The socio-economic and environmental context in Latin America and the Caribbean is a scenario in which hunger, food insecurity, and malnutrition have increased. Political decisions are required to achieve sustainable, sufficient, inclusive, and efficient agri-food systems that generate equal access to a healthy diet for all. Climate change threatens life, health, and well-being. However, we can contribute to its preservation from wherever we are, generating social policies and a sustainable development model. By joining an initiative in defense of the environment, buying local products and plant-based foods, we can use public transportation, cycling, or walking, as well as reducing consumption by reusing, repairing, and recycling. It is everyone's duty to restore the relationship with nature. It is necessary to recognize the ancestral knowledge of the native peoples who have lived in balance with Mother Earth and practice good living. Well, in accordance with the above, today, Thursday, November 10, we open our virtual doors to discuss a topic of great importance for our region. One health, human, animal, and environmental health. We invite you to leave us your name, organization, and country from which you're joining us through the comment box of the Facebook Live or YouTube Live chat. In that same space, you can leave your questions or send them via email to webinarhorasconu@gmail.com. To access the certificate of attendance to this webinar, as usual, you must fill out a short survey and leave your data in the fixed link found in the Facebook Live or YouTube Live chats. The certificate will be sent to your email in the next few days. This webinar will be developed with the usual dynamics. We will start with the institutional greeting, then the presentations of our speakers, the active pause, and the space for Q&A. To begin this important day, I give the floor to Dr. Marisela Malki Osorio, Deputy Executive Secretary of the Horas Konu, who will give the welcome and institutional greeting. Go ahead, Dr. Marisela. Thank you. Good morning, good afternoon, depending on where you're located. Welcome to all the participants, especially our acknowledged and recognized speakers. The Andean Health Organization Hipólito Unanue Agreement is an integration institution that works in favor of health and well-being of the population from 6 countries, Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela.
Agradecemos por el tiempo que
We
nos brinda.
thank for the time that you give us today for this webinar number 149 since we started in May of 2020 with this cycle of webinars. In this opportunity with the important topic, One Health, human, animal, and environmental health. All living beings in the world share the environment sources, air, forests, oceans, and rivers. But we also share deadly pathogens responsible for diseases such as COVID-19, tuberculosis, or influenza. Of the millions of species of microorganisms that exist on Earth, pathogens are about 1,400 microorganisms that can cause human infections. It is estimated that at least 75% of emerging human infections, diseases, have an animal origin, and 3 out of 5 new human diseases each year have an animal origin also. Domesticated animal species share an average of 19 zoonotic viruses with humans, and wild animal species share an average of 0.23. Thus, it is not surprising that the vast majority of animals involved in historical zoonotic events or current zoonosis are domestic livestock, domesticated wildlife species, and pets, given the high rates of contact with humans. The emergence of a new zoonosis in wildlife species is extremely rare, but can be very significant. Globalization and climate change, unregulated trade, unsustainable agricultural practices, our consumption patterns facilitate the emergence and spread of diseases among domestic and wild animals and humans, endangering the health of all, as demonstrated in 2020 when the COVID-19 pandemic starkly exposed the intrinsic relationship between animal, human, and environmental health. The One Health strategy is an integrated, unifying approach that seeks to sustainably balance and optimize the health of people, animals, and ecosystems. The approach recognizes that the health of people, domestic and wild animals, plants, and the wider environment, including the ecosystems, are closely interrelated and interdependent. And the response to the zoonosis crisis, in this case of COVID-19, highlights the need for coordinated action between different sectors to protect health and prevent disruption of food systems. Ensuring a One Health approach is essential for making progress in anticipating, preventing, detecting, and controlling diseases that spread between animals and humans, tackling antimicrobial resistance, ensuring food safety, preventing environmental related threats to human and animal health, and fighting against many other challenges. The adoption of the One Health approach is also critical to the achievement of the Sustainable Development Goals. Building this governance has taken the form of a tripartite cooperation between the World Organization of Animal Health, the World Health Organization, and the Food and Agriculture Organization of the United Nations. For several years, this collaboration has helped countries deal with problems such as antimicrobial resistance and emerging diseases. While collaboration between human and animal health services is well established, The environmental sector must also be included in order to properly and comprehensively realize the One Health concept. Therefore, the tripartite collaboration is being expanded to include the United Nations Environmental Program to reinforce its One Health approach. To learn more about One Health strategy, we have invited two prestigious professionals, Dr. Gabriela Salmon, public health specialist of One Health, and Dr. Christopher Norman Hamilton West, professor of the Faculty of Veterinary and Livestock Sciences of the University of Chile. Welcome again, everyone. Thank you.
Muchas gracias.
Thank you, Dr. Marisela Malqui, for your opening words. I would like to introduce myself. My name is Luis Bengolea Moore, medical epidemiologist, coordinator of health in frontiers and borders and thematic areas, and I'm pleased to be in charge of moderating this webinar. To control emerging infectious diseases, including zoonosis, and to reduce the risk that they become pandemic or epidemics, we need to understand their origins, different types of importance at the different communities, as well as the factors that trigger them. To learn more in detail this interaction today, we have invited two experts from the University of Chile and from the Pontificia Universidad Católica del Perú that have already been introduced by Dr. Marisela Malqui. We will start this event welcoming Dr. Christopher Hamilton West. Dr. Christopher obtained his veterinary medicine degree from the University of Chile in 2006, highest distinction, completing his master's degree in animal and veterinary sciences, with mention in animal preventive medicine at the University of Chile in 2007. In 2010, he completed his PhD studies in the Silvo Agropecuary and Veterinary Sciences program of the University of Chile. During his doctoral studies, Christopher received a scholarship from the National Commission for Scientific and Technological Research from the government of Chile. Between 2009 and 2011, Dr. Christopher worked in the Food and Agriculture Organization of the United Nations, the FAO, as a veterinary epidemiologist at the Rome headquarters. And since 2011, he joined the Faculty of Veterinary and Livestock Sciences, the University of Chile. He is currently Associate Professor of the Ordinary Academic Career and Director of the Department of Animal Preventive Medicine. From here, we give Dr. Christopher a warm welcome. Good day. You have the floor. Go ahead, Doctor. Thank you for the introduction and the invitation to participate in this webinar. My greetings to all. I will start to share my screen.
Y bueno, el tema que quería conversar con ustedes en este
that I want to share with you at this moment is about the human-animal interfaces in South America. This is a key element to be better prepared and to respond all the zoonotic threats that we may be facing. Given that this is a wide topic, it's interesting that today we can start discussing about a contingent situation in our region. Some months ago, this occurred last May. There's an alert from the OIE where they make this call to increase surveillance actions due to the increase of cases of avian influenza in different parts of the world. This is a situation different to what we've seen in previous years. This is a disease that constantly affects different parts of the world to the animal population, but there's a significant increase of the number of cases a major difference. In this last year, we have recorded several types of influenza that are causing these high pathogenicity events, as opposed to the current or normal situation where the predominant subtype of this event spreads with different magnitudes every season. This situation, as I mentioned, is quite abnormal. Have so many subtypes moving around. Some of them have been recorded in humans, so it generates this alert. Before telling you how this situation has involved of high pathogenicity influenza, we need to say a few words about the influenza virus that have been mentioned as one of the major threats that we have in this context of public health. We can say the influenza virus are perhaps one of the most challenging pathogens recognized for animal health as well as human health. The influenza viruses circulate in bird populations that are reservoirs, usually to water birds, and we found the most important, which are these types of animals. This is what we call ducks and seagulls, as you can see in this image. And they are the ones that keep circulation of the different varieties of influenza virus. And from this population of wild birds, which are the reservoirs, there's been an emergence of some subtypes that has been stabilized in other animal species. That is how we can now clearly identify some viruses that are like the porcine flu or horses, the equine influenza virus, some to marine mammals, and we also find the human influenza virus that year after year generates some problems, and many of us are constantly vaccinated to improve our levels of immunity. In the area of animal health, the most relevant, the one that we found in hens, turkeys, some geese, domestic animals, we can generate a disease called high pathogenicity. This is a disease that generates a high mortality in these groups with severe signs of disease, but in some cases, the disease is so violent that we don't detect clinical signs in the infected birds, but we just see them dying. This is a disease that has a very severe clinical manifestation, and as all the influenza viruses have a high transmissibility. In terms of why the influenza virus are considered a pandemic threat, this is because in humankind history, many events have been associated to pandemic with this influenza virus, and here we find a very important element because of the possibility of mutation and recombination that influenza viruses have, where pigs have an important role because they are a source of a mixed container with viruses from different origins. So we can have situations where the swine are exposed to avian flu, to the porcine viruses and human virus, and we get this scenario where the same individual can be infected with viruses from different origin during the entire process of viral replication in the swine. We can have the emergence of a human influenza virus where we recombine segments of the genetic materials of the viruses from different origin. For example, this is the case of H1N1 of 2009, which is a multiple recombinant virus with some segments from classical swine virus, avian influenza, and human influenza. These events of pandemic associated to influenza virus have been recorded in several occasions in the history of humankind. Perhaps the most important is the Spanish flu in 1918. It estimated that it was responsible of 50 million people. Then other events have been reported as pandemic. The final one reported H1N1 in 2009. Although it is true what we see in human health, with this pandemic event associated to influenza virus, it's also important to understand what's going on with other influenza virus that are circulating in different species. And here is relevant what I mentioned about this high pathogenicity avian influenza in domestic birds. And we found that so far we recognize two types of viruses, which are the H5 and H7 that cause this type of disease that generates high mortality in birds. And these viruses emerge. The H7 approximately at mid-80s and H5 in the mid-90s. And from there, they have created a large interest by the health authorities and scientific communities of some countries, because we can be facing a scenario where some of these viruses that generate these serious diseases in birds may be the origin of a new virus that could be spread to people and among people, generating a threat of a pandemic that may have an impact as large as the Spanish flu in 1918. So that is why it is very important to understand what happens with the influenza among different animals and transmitted to people, and understand this interface is something very relevant. As I mentioned, the influenza virus circulated in high pathogenicity in wild birds, and these populations are precisely because of their behavior and the habitat where they live. They present migration behavior. These two species move between different geographic areas depending on what we see in the environment where they live. Sometimes they move away from extreme conditions of cold, for example, or when there's food shortages, they move to other places, and they have established many migration routes for these species. If we see this image, we can see for our continent that we have three main routes for migration, connecting the north with the south, the Pacific migration of the Central Flyway, and in addition, many migration routes that communicate Europe with Asia, Africa, and also some of these flyways can create this connection between Europe, Asia, Africa, with our continent in the north part, both through the pathway of the east of the Atlantic or the Australian eastward. This is one of the ways explains how influenza viruses move throughout the world through this migration of wild birds, and together with the trade and movement of persons, it can explain the global spread of the different influenza viruses. But now going to back what I mentioned at the beginning to this alert by the OMSA or the OIE about the influenza virus, we're going to find different elements that have occurred in recent months. For example, since January, there is an epidemic situation in the US with cases of high pathogenicity avian influenza or HPAI that is generating problems in North America. It's a virus that had an intercontinental movement with viruses of Eurasian lineage that reached North America, been estimated following some studies at least one season before they circulated in the wild bird population to start to recognize these infections at the beginning of this year. This has caused the death of more than 50 million birds, a very significant number for avian production that has repercussions on safety and this availability of food. And this situation continues with significant levels of outbreaks recorded day after day. That is why there's another FAO alert specific for Central America and South America issued by FAO due to the high risk that we have at this moment about the possibility of introducing this high pathogenicity avian flu virus.
Busca que los países estén más alerta de
So this alert is looking for countries to be more pay more attention, but we realize that this alert was issued in September, was very close to the migration season, and we are receiving some of the things that we were expecting, that one of these high pathogenicity virus arrived to South America. This is official data from Colombia to OIE, where the first cases of HPAI has been associated with some backyard flocks. These go from North America to South America.
La presencia del
We also
virus.
recorded the presence of the virus in Mexico that was reported a few days ago. And they also seen other changes that have been generated in different areas, like in the US. It's been recognized that there's an H5N4, it's a recombinant virus with some segment of this HPH1N5 with acquired segments of other locally viruses. So this is the context where we need to be quite alert, thinking in all the repercussions with these influenza viruses, but it's also interesting to look what do we know or what was happening in South America that unfortunately is perhaps one of the most neglected areas in the globe to recognize these conditions in many other pathogens. We had very few history of these influenza virus in the region. There were some studies, for example, the one in Argentina, where they identify some H9 viruses, and we start to establish some type of difference with those that circulate in other parts of the world, and with the possibility of some South American lineage. Some studies performed in Peru with a very prolonged surveillance showed that there's a significant diversity of influenza virus circulating in wild birds in Peru, but all these viruses were associated to those circulated in North America, of North American lineage. And there was also some detection in Bolivia of virus in wild ducks related to a virus detected in Chile in 2002. That was the only event recorded of a high pathogenicity avian influenza in the region until 2 weeks ago. After that event in Chile, we had some other cases of avian influenza of low pathogenicity in highly technified production systems that generate sporadic problems in different years and a couple of detections in wild bird populations. With all this context of influenza virus, our research group were always surprised and curious about a particular subpopulation, which are called the backyard production systems. This is perhaps the animal production system the most extended globally, and our region, in the countries in this region, is a very cross-sectional practice. It's seen in every country with some differences, but we can characterize it as a type of animal production where there is very few biosafety measures, where species are maintained that require a low economic input for maintenance and obtain food outputs that may generate income for the home economies, which are usually poor in the rural areas. And these are species of swine and birds that require the less economic input for their maintenance. In this type of farms, there's a very close contact within the people that live in those homes and manage these animals. That in Chile, we see either a lot of elderly or children tries to find work in other areas. And the people that remains at home to manage the animals has a close contact. And there's also the possibility that these animals have contact with animals from other farms, because sometimes they're free roaming during the day, so they can find some food from the environment. And there's also the possibility that they can be in close contact with wild animals, rodents, and other animals from that area. So for us, these productive units are very interesting because we understand that there's a susceptibility to disseminate infectious diseases that may be extremely high. And summarizing several years of work, we were interested to see what was happening with this type of population. And we took a model of the influenza viruses because of the interest and impact that they can generate. We did some surveillance activities in backyard farms, and we find a level of positive very high. That was extremely high, 25% of evidence of infections in these farms, plus viral circulation. We work with two types of diagnosis, serology to see if there was exposure of swine or birds to influenza, and also the techniques through real-time PCR that we could identify the circulating virus at the moment we took the sample. In these activities, we were also able to identify and isolate a swine virus, which is a new virus because it's a virus that differentiates from viruses circulating in other parts of the world because of the recommendation, has some segments of the classical swine viruses and some segments of human influenza virus. And through other analysis, we could extrapolate the possibility of transmission among people because being so close to animals can generate a type of spread. We're also interested to characterize how these systems work in backyard production because we can understand what goes in and goes out from this farm through the value chain development, allow us to evaluate different risks for dissemination of pathogenic agents. After having these data collected of the levels of infections in backyard production farms, we would like to know where those viruses come from. And of course, we were interested to see in these populations that we know have influenza viral reservoirs, we could have more than what we knew that was circulating based on previous history. We did a characterization of the areas where wild birds concentrate. We prioritize these areas where we can find a higher possibility of identifying influenza viruses. We were working on site. We have more than 70,000 samples that have been analyzed on different parts of Chile. And with that, we were able to describe an important diversity of influenza virus. At this moment, we have the largest collection of influenza virus isolated from South America, which has allowed us to learn more interesting things about the epidemiology of the avian influenza viruses. We may say that there's a large diversity of site type with the presence of the viruses throughout the year in different areas in Chile, with prevalence levels that are high between spring and autumn seasons, precisely when we receive the migration birds from North America. We find this an important association with some environmental variables such as the size of the water bodies or the vegetation where these wild animals concentrate with higher minimal temperatures. These are the ideal conditions for an increase in the prevalence of influenza viruses, at least in Chile. We've also carried out phylogenetic analysis of the isolated viruses, and we can mention the presence of virus from South American lineage that have involvement in this area of the world, and they are differentiated from those who circulate in Europe, Asia, or in North America. And we also identified the possibility that at least in Chile, we think it will also be extrapolated to the countries of the region. We have this coexistence of viruses because of the older segments are South American lineage versus the input of some virus that come with migrating birds that have a North American lineage with the presence of 5 viruses that start to be new, where we see these events of recombination. We also be able to identify several species of wild birds that we get presented as reservoir of influenza virus. Here we have 2 ducks with their scientific name, Anas georgica and Anas flavirostris. and we found the largest diversity of influenza virus, including H5, H7 subtype, which are the interesting because of the disease that they may cause in domestic birds. With the data that we generated, we're able to work in the investigation of some of these events that I mentioned of low pathogenicity outbreaks in production areas, industrial production areas. And these are the recent cases that the viruses that cause this event is a multiple recombinant from the other segments that they have. We can identify that these had 7 different viruses. So it talks about the possibility of recombination, the possibility that we can have the emergence of a new variant of influenza virus in our area, and we should be very alert. At present, we are working with our group is to try to better understanding of this interface between the wild bird population, which are the reservoirs of the influenza virus, with domestic birds that are kept in production systems, backyard production systems, and see how this movement of viruses from these different subpopulations and evaluating the role that some species may have by linking with other smaller birds, like the passeriforms that sometimes are sharing this environment. They eat where domestic animals eat, and there's a concentration of wild birds. And also we are studying at this moment what are the risks related for people who handle these farm animals, and we are characterizing all the activities they carry out with the animals, how long is the contact lasting, what activities they carry out to evaluate the possibility of pathogen transmission. Some of the things that we are doing is to improve the information required for generating epidemiological models by identify these contact rates between people, animals in the farms, and the wild animals. Here we are recording at different times of the day in the farms and to characterize this type of contact. And we have been able to capture the small passeriforms to see if there's a possibility of influenza virus. At this moment, we haven't identified 1.5% of positive in these birds, establishing some role in the possibility of transmission and movement of viruses between these two environments. With all these results, what we are doing is to generating epidemiological model to see how these events may occur in the transmission of HPAI in backyard production systems to generate some management to trying to contain these outbreaks with a less impact, because by lowering the viral load, we can protect the health of the animals and people. So at this moment, we can conclude that we have a high influenza virus diversity in Chile, the most largest reported for South America. The virus can circulate during all year with endemic reservoirs of wild animals, and these viruses generate sporadic cases in commercial plants as well as backyard that can be associated with different risk for the people who work in these commercial farms that may be exposed to high amounts of viruses, or people who have very close contact with these animals in the farm throughout the day. That is why we are proposing this important to learn how these interfaces work. This is a contact within wild animals, domestic animals, people, because with this knowledge, we can generate some strategies to see how we can prevent these events, preventing the emergence of pathogens or their spread. We want to focus our surveillance efforts and increase our preparedness to respond to all these events. Finally, I think that in our region, we need to have a wide vision. Perhaps we may be considered as one of the hot spots for the emergence or reemergence of some pathogens that may have impact on public health, food security, or animal health. We have a large diversity of wild species. We have a large diversity of vectors that can maintain some pathogens. We should be studying them with more attention. And as I mentioned, I think that we are the most neglected global area to identify these threats before they generate any problems. And here, with the interfaces that I were mentioning between these backyard production systems, this is important in some countries. For example, all the markets for live animals are traded. People identify the animal they want to eat. It's also important for our reality, the relationship with the different original peoples with animals, because the closeness to them or how they manage and consume is different, generating the adequate environment for the transmission of pathogens. It is also important what we have seen with these pandemic years where we were most confined, the relationship with people and their pets. Many people, the closest people to their pets, lived with them large portions of the day, maybe eating together, sleeping together, and that generates another risk scenario. And finally, in our region, consider the tourist attraction for people who come from different parts of the world for outdoor activities, sometimes going in areas where wild animal species live, where there may be circulation of some pathogens that we don't even know. And that can become a risk to people. I would like to thank for my presentation. This is my team where we work at the epidemiology unit at the veterinary sciences in the faculty in the University of Chile. And our research group is part of the Center of Excellence for Influenza Research and Response from the NIH in the US, together with all the other finance sources that we have for our research in Chile. Thank you. Thank you, Dr. Christopher Hamilton, for sharing this interesting presentation where you have considered to show us the relationship with regards to the other pandemic, not only in humans, but also in avian. And one of the characteristics that you showed, risk map and the impact map in birds in different outbreaks in the northern hemisphere, but you haven't given us not only that information, but you have shared the different pathways of transmission through the bird migration. You've mentioned that our three scenarios where there are different migration modes are involved not only with the countries of the Northern Hemisphere, but also have moved to South America, Africa, and Australia. This process is significantly increasing and has generated that this year there's been an impact with an significant economic cost, such as what you show, the death of 50 million pen birds in North America. That's also been seen in France, and is also with some cases in humans. At this moment, not massively, but in those who had close contact with these birds for the maintenance and feeding. The other important topic of this interaction between the nature, the human beings, both animals and persons. You showed us the different viruses that are emerging and have been very important in studies that you have performed in Chile with an important number of samples, but also you've been able to identify the epidemiological characteristics of the presence of these viruses in different species. One of them is a little duck, very resistant, but that's the messenger of these viruses that has been contaminating the waters where they arrive after migration in the lakes, and they contact other species that are also wild. And the most interesting and important of this interaction that you've shown us, that it not only affects wild animals, but also has contact with farm animals. In particular, the experience you showed us how we in South America and in Central America have breeding of these animals that has many risk factors, although it generates economy for them. We consider that it's important for our audience that follows us to know that there is a need to take measures, special measures, at the highest level, high integration of efforts among the levels that have to do with animal health, the environment, and human health. Thank you so much, Dr. Christopher. We invite you to remain online so you can answer the different questions that are already arriving. Thank you, Dr. Hamilton.
Todos tenemos que ir engrosando.
Now, we all have to be becoming part of this army that tomorrow will be considered heroic, much more than those who fought with their arms at hand. The army of the ones who say we need to do something to protect a mother that doesn't complain, that has given us everything we have and that we are killing. This is a message from Felix Rodriguez de la Fuente, who lived in 1928 to 1980. He was an environmentalist from Spain, and he left us this value message. Now, we would like to welcome Dr. Gabriela Salmon Mulanovich. Dr. Gabriela Salmon Mulanovich is a public health specialist. Her research uses a One Health approach to evaluate how environmental factors are related to health and well-being. She did her undergraduate studies in sciences, biology at the National Agrarian University of La Molina. She studied epidemiology at the master's level at the Universidad Peruana Cayetano Heredia. Her PhD at the International Health Epidemiology and Global Disease Control at Johns Hopkins Bloomberg School of Public Health. Dr. Salmon Mulanovich is committed to research and teaching for evidence-based public policy implementation. She has extensive experience working on complex projects. She has worked with interdisciplinary research groups, local and regional authorities and entities, as well as academic and research institutions and health systems. As a researcher, she has published numerous articles in disciplinary and interdisciplinary studies, including climate change and our health, and neglected emergency, and tropical forests, global change, and human health. Welcome, dear Dr. Gabriela Salmon Mulanovich. You have the floor.
Buenos días, muchas gracias.
Good morning for the invitation. I would like to go and share my presentation.
Esta mañana voy a ampliar un poco lo que
This morning, I would like to expand
Christopher.
what Chris has shown us, and I will go into to look a more bigger picture, which is also climate change and the importance of including health and how to do it in adaptation and containment plans that are considered at this moment. In fact, at this moment, while we carry out this webinar, there is the conference to look at these climate change issues. We're going to look at climate change, their link to One Health approach, the importance of incorporating health in topics of adaptation and containment. And I would like to show you some examples of Medellin and Loreto in Peru, of how we can do the incorporation of these indicators. I think that we all seen a similar picture of the last year's report where they show indeed the human activity has been increasing the ocean's temperature, and this has generated a number of changes that have been, some cases have been faster of what had been anticipated. And we also look at what Chris showed us about the concept of One Health, which originated linking veterinary medicine and human medicine when they realized that there's a number of diseases that we very well know that between animals and humans, but also it was expanded to include environmental sciences and to see environmental health as part of this concept of One Health. We can see it perhaps shown or represented in different or several ways. We can see one of those models is used, One Health. We have environmental health, ecology, veterinary medicine, public health, human medicine, molecular and microbiology, health economics, and then we have zoonotic infections and the translational medicine. This is a model of many that could be proposed. The essential is that we're looking at health, considering this environment, which we're all being part of, and I'm referring to all animals and persons. And if we see in climate change, we can see, we know that this generated because the emission of greenhouse gas that in generating changes in the temperature of the ocean, the environment, of the earth, and this has an impact on health. We can see some intermediate impacts with regards to agriculture productivity, and that is reduced, the biodiversity loss, ecosystems collapse, something that is currently being documented. The an increase in environmental pollution, and of course, these changes are going to have an impact on our health. And when we think in One Health, we could think these changes due to climate change. We usually think in vector-borne diseases such as dengue, chikungunya, Zika, but also there are a number of other impacts such as undernutrition due to this low productivity, or the impact on mental health, such as diarrhea because of the poor quality of water, the impact on mental health, on cardiovascular health, which is important because of the pollutants in the air that are also generated by these greenhouse gas emissions that are liberated or released into the atmosphere. We see the different heat waves may also have an impact on cardiovascular diseases and respiratory diseases as well. However, something that I would like to highlight in this presentation, and this is something that has been being considering for many years now, are the co-benefits that we can have by approaching the effects and the impacts on the environment.
de
and
medidas
by taking a number of
para
measures
mitigar
to
los
mitigate
impactos del cambio climático
the impact of
y
climate change and
los beneficios
the
que puede
beneficial
tener
impacts can it have or health in benefits
sociales y
and social benefits and in our environment.
Estos son una serie
So these are
aspectos que debemos tener
many aspects that we need to consider,
cuando pensamos
and it's important when we
por qué es importante
think
incorporarlo,
why do we need to consider them,
incluir la salud en los planes de
and
adaptación.
including health in the adaptation and containment plans. We could summarize perhaps with this, because there's a number of co-benefits that we're going to achieve, not only they are directed to the immediate impact, but to other type of activities
y de condicionantes que van a
and
favorecer
conditions are going to favor a better health of the population.
De hecho, esta
In
semana,
fact,
como les estaba
this
diciendo,
week, as I mentioned,
en la COP se está presentando
in the COP,
los trabajos de los distintos reportes.
works from different,
Está presentando
the
también
papers from different reports have been presented,
que es un
such as the Lancet Countdown,
hace
which is
indicadores
do a follow-up of several health indicators
con el cambio climático.
related to climate change.
La doctora Stella Hartinger, con su equipo,
Dr.
y el
Hartinger and their team from the Universidad Cayetano Heredia is presenting this report and providing this information, and we have generated what I'm showing, which is a policy guidelines where we indicate specifically for Peru, but this is being done
para los distintos países,
for other countries where we can
mencionar y podemos ver cómo se ve una
see
mortalidad
how there's a heat associated mortality in this population group when we compare 2000 to 2004 and 2017 to 2021. We see impact in vector-borne diseases and of course on cardiorespiratory and renal diseases. And this is just thinking in the increase in temperature and extreme temperatures. But it's also important to consider, at least for the case of Peru, the adaptation national plan is focused to extreme temperatures. They are not considering that there's a number of microclimates that are being generated and that may have very difficult conditions in some environments. So perhaps this plan needs to focus more on what we're going to see later in the presentation.
Dar un mayor peso a la
Give
adaptación
more weight to adaptation and prevention
extremos
of
en sí.
these extreme events itself. Also, air pollution has been reported in these policy guidelines
el impacto que tiene en
as
la
the impact in mortality
partículas
due to these
partículas suspendidas en el aire y el
air
costo
particles and the cost for Peru to 1.4% of GDP of 2021. So what I'm going to tell you ahead, you can forget, but remember why it is important. If you want to think why to incorporate health in these adaptation and containment plans is the importance, so we can prevent this premature death and to prevent this high costs associated with the impact of climate change. And this approach of One Health is instrumental to understand and to think on the preventive measures that we need to consider so this can be effective. And how? How can we do this? And sometimes we think that we have to look
ejemplos muy sofisticados,
very sophisticated examples in countries where
en tecnologías muy
large investments have been done in technology
muy complejas Y sin embargo, yo les traigo dos
But I
ejemplos.
bring you two examples, one from Medellin, Colombia, that perhaps you already heard about it, and another one from Santo Tomás in Iquitos in Loreto, Peru. Some aspect that I consider that we need to take
incorporar de mejor manera estos
to
indicadores de salud.
include them as health indicators. The first thing that we need to consider is to focus on sensitive populations.
Por ejemplo,
For example,
personas mayores,
the elderly,
personas que
people
están,
who,
niños pequeños, que si
small
pensamos
children
en los picos de,
with
o quienes se ven más afectados por la
those who are more affected by heat or by temperature changes. We also think in the population that can be sensitive because they're vulnerable with a higher risk due to their activities or their, if we follow what Christopher mentioned, those sensitive populations could be those communities that work with breeding these backyard production plants.
¿Cuáles son esas poblaciones sensibles? Pero además debemos
The
tener
plants need to consider those sensitive populations. Well, we need to an area, and we're talking about this territorial approach. This is the city of Iquitos, and this is Lima, the coast where there's a desert. These are conditions that are quite different. And we're thinking in plans for adaptation and contention. The health indicators are different than the ones that we collect in Lima compared to those in Iquitos. For example, in Iquitos, we have the simultaneous circulation of dengue, chikungunya, and Zika. And in Lima, perhaps there are other approaches that we should have. This is, for example, in Cusco or Andahuaylas. These are cities that are at the higher level above, higher levels above the sea. We have particular conditions where these plans of adaptation and contagion require to be focused in this context. In addition, of these adaptation and contagion plans, we need to have indicators in terms of health that are going to require a multi-sectorial approach in the local participation. We can see in this taken from these Peru, data from Peru, where we can see that we talk about droughts, vulnerability due to intense rain, exposure to cold weather, extreme cold weather, and food security. This aspect need to be considered through the different sectors. And if we follow what Chris showed us, we think perhaps in vulnerability due to the emergence of some virus, with the potential risk of pandemic viruses. We also need to think that perhaps we should work with the agricultural sectors in wild fauna to do a adequate preemptive approach, and it is key. This needs to be worked from the prevention, see how we're going to adapt, how we're going to work those production plans for adaptation and contention. Therefore, we can make a good use of the funds and the investment made when we consider the prevention of such events. And finally, it's important to monitor and evaluate, and for that, I would like to make a call, because it's been very difficult to find publication if index journals where they talk about monitoring and evaluation in some health topics related to climate change. I've been able to collect, and of course, the 6 countries that are part of this agreement must have experiences that would be important to share so we can learn and capture the best experiences from those countries. This paper is somewhat old, comes from Australia, and they present 5 cases of examples where health promotion was considered with regards to climate change. And in most of them, they carry out monitoring and evaluation of the work that was done, and we can see some of the results.
Financiamiento para desarrollar mayores actividades, pero sobre todo lo interesante es
That was interesting to find. I would like to link this to what I mentioned before related to multisectoriality and local efforts. These activities in these study cases were
centros de salud
carried out in 2 regional health facilities that were not necessarily large, one in the rural area and one with also working of primary health care. So with that, I would like to show you the examples that I commented on. Perhaps in Colombia, using this integrated transportation system, considering the context. This is more than one local initiative according to the needs of the environment that had a number of challenges due to the difficulties to access some of these areas because of the geography, and they developed this system, integration transportation system, with a cable car, the metro, and a bus system and bicycle path. And of course, there is room for improvement, but I think it's important to highlight how we focus this territorial approach and this local initiative, and of course, the need to do a multi-sectorial effort. They've also been working on this green belt, consider the increase in rain that we're going to have in this area that comes together with early alert systems in reforestation for slopes and some preventive activities of adaptation and containment. And this is another example that I would like to show you in Santo Tomas, in Iquitos, in Loreto, in the Amazon basin. This is coordinated by Belén de Mesón. You can find more information, but she's an architect, but they decided to work a water uptake and water treatment system with linked to some activities in the community. This is some of the important aspects in terms of disease transmission. There was water and sewage management in Loreto, and we can think that Loreto, as somebody told me once, we live surrounded by water, but we need water because they need quality water. They need adequate water to cover the home needs. So with this system, with uptake, was a co-production work with the community where they made a diagnosis, planning, design, the construction, and then a monitor. And this was a co-production model at different stages. These are the activities carried out in the area. Laundry, bathing, that was done with the at the river, and also some leisure activities where they can carry out some leisure activities with the community. The planning was carried out, so how to make the design of this water rain uptake or collection, and this was the participative designment. And these are some pictures of the work that was some of the tests about the water quality with the treatment system that was added. These are the final stages of the construction. And finally, the use that's given to this space for bathing and for play.
Y si nos ponemos a pensar,
And if we start thinking, but I haven't shown you the initial images of how this activity were carried out in the river, where they can have risk for small children. This is a safer environment, and ideally we would like to have in the future to see the impact that it can have in some waterborne diseases with this type of activities.
De estrategias. In
summary, we've seen that given the impact in mortality, in early death, and the costs, and the need to include health in these aspects of adaptation and comment, focusing on prevention. We're going to start thinking how to respond once that we have the outbreak, as Christopher mentioned, or when we have the El Niño or a mudslide or flooding with the some river increase of volume. We are late. We need to think how to adapt and how we can work with these plans in the preventive fashion. This is not being done. This is only done in the health sector, but we need to work with the other sectors. It's also important to consider the context, participation and leadership of local communities and local authorities. A few days ago, we had an election of local authorities in Peru, and this is something in which they need to work for a long time. So we're late. There's something that we need to do now. As I mentioned, it is the focus on sensitive populations to make sure that our adaptation and containment plans are going to go to the populations that need it the most, or we're going to have the biggest impact, and to have this monitoring and evaluation in order to make sure the sustainability of these actions. I have nothing else for now. Thank you very much.
Muy amable, doctora Gabriela.
Very kind, Dr. Salmon Mulanovich. You have given us an important overview in regards to what we need to understand for a One Health strategy, and you have underlined the need to do an
interaccionado, ¿no? multiple
action among the different areas that manage human health and who work with animal health and also with the environment. You have provided important information that climate change has increased the possibility of having epidemics, but also has increased poverty. And an example that you give us and we also share is what we've seen at this moment with avian flu and its impact in the deaths of 50 million birds from the market, just to speak of one example of this impact. And that it not only remove cheap food from the market, but also the consequences, because that market is going to take time to recover. In all the products that increase their prices, such as the eggs and poultry meat and have less access to protein. An important example is what is the effort being done in relation to the impact of the environment with extreme temperatures and human health. You gave us an example of how this is affecting the elderly with a higher concentration of heat due
combustibles
to the
fósiles
use of fossil fuels that pollutes the atmosphere. The increase of cardiorespiratory and renal diseases with the excess of temperature, with the presence of vectors that bring many diseases in people and populations. You have also indicated water or air pollution has generated a large amount of death due to air pollution. And among these proposals, you've given us two excellent examples of how we can create change rapidly, but there is the need to joint effort. One of them is what's been done in Colombia, Medellin, where they have decreased transport with fossil fuel consumption and have adequate different routes to facilitate people's movements, and also the need to have some important approaches to identify the populations that are more sensitive, the ones that are at the highest risk of being affected by this climate change, and also to identify what is the strategy that needs to be applied depending on the territory or the geography in countries throughout the world, and also the need to have a community participation that's more intense, to educate the population and to use the change of authorities that bring new ideas with a lot of wish of doing good in their communities, and also the need for a multi-sectorial approach. There are many experts that are working, but they need to coordinate among them to have a response with a higher impact. And finally, one of the important elements or important components in this strategy, and our executive secretary, I always insist, is that work on this topic is monitoring and evaluation. Well, Dr. Gabriela Salmon, thank you so much for your excellent presentation. And now we will move on to the Q&A.
Comenzamos con el doctor.
We will start with Dr. Chris. And the first question is, what importance and/or opportunities do we have with the Genomic Regional Network to continue with research in this topic? What are the most important challenges that you identify in their use? Go ahead, Dr. Chris. Well, it's extremely important when different parts of the world to share the information when we generate this type of networks that share their results. This generates global benefit, which is the ideal of what we are doing in research. Hopefully, there will be many research initiatives to collect more information, especially of the countries in our region, and then that the information hopefully is shared from different areas for more complex analysis and understand better of how these pathogens evolve, for example, that allow us to have a higher level of alert and to have a better preparedness for a response. Thank you, Doctor.
Una segunda pregunta.
Second question, how does global warming could affect the epidemiological characteristic of influenza in our region?
Un impacto
Well, that has a large impact because, as I mentioned, we see that wild birds that move viruses throughout the world have this migration pattern because they're looking for an environment that can have better feeding and reproductive activities. So when these effects of climate change changes the conditions, these migration routes can be affected because the environments where they usually carry out their activities, they need to find other flyways, and this lead to different dynamics for pathogen transmission that can have a greater impact. For example, in Chile, we're not talking about the possible effects of climate changes. We are seeing them for many years. The predictions that we did years ago thought that we're going to have a decrease in rainfall, an increase in temperature. And this is something that we've evidenced in recent years. We're going through a 20-year-old drought for 20 in the central area that is aligned with those predictions. And that leads us that the water bodies where these animals concentrate are drying, disappearance, and their distribution changes. And many times we see areas where these water tanks are generated for irrigation or large operations of livestock, generate these artificial areas where the wild animals arrive. So everything has an effect and a large repercussion. And a final question, what are the most important challenges to boost the participation of veterinary physicians in the health sectors? What would you recommend in this regard? Well, there's several things that we can mention. Something is the regulations of the countries, and I can give you the example of Chile, where veterinary physicians are not acknowledged as health professionals. We have a very important role at the global level that's related to veterinary public health that has to do with food safety and diseases that may be zoonotic. I think that that recognition is extremely important. The idea is not that each profession has a specific niche, but also that they can generate the possibility of interaction with working teams with different competences and visions. In the personal experience in our group, we always look to interact with people that can have ideas that are different to the ones we have. We need people that know about people, for example, sociology, anthropology. When we involve environmental topics, we need people with other competencies that are different to the ones we have, so we can generate multidisciplinary teams that can have this approximation to better understand the processes that involve the concept of One Health. Very kind, Doctor. Dr. Gabriela Salmón. The first question is the following. What do you consider the most important barriers for scalability of the positive experiences that you have presented? What would be the most important recommendations to overcome them?
Creo que
I think that perhaps one of the most important barriers
no necesariamente estas
is that these initiatives are not necessarily communicated, and the territorial approach is extremely instrumental for these initiatives. And
el compromiso de la
the commitment with the community that we are working for these changes is also instrumental. I believe that those two pillars, adequate territorial approach and a commitment by the community that includes authorities and the different stakeholders, are key to translate good initiatives, good experiences to other environments that, of course, are going to need to be adapted to their context and that are adapted and incorporated with the commitment of that community where they're going to be carried out. Thank you, Doctor. As second question, what opportunities and limitations do we have in this region to increase the health sector participation when they approach climate change? Opportunities, I think there are many. I think that the most difficult thing is to understand the other sectors. The approach of climate change need to be focused on prevention, and that not comes from the health sector. The heat waves with a major impact that despite of when I mentioned that the National Action Plan in Peru only consider those heat peaks. They're not considering a gradual prevention, but we have some areas with microclimates where are quite complex and when temperatures can go as very high levels. Those environments require a number of preventive activities that go beyond the health sector. We need to work with local authorities, with transportation, water, sanitation, transportation. So perhaps that's one of the most important barriers. We have to move out from the ministry and contact the other stakeholders that need to be involved for an adequate work from the prevention side. Thank you, Doctor. And a final question. What are the priority strategies to boost innovation projects to mitigate and adapt to climate change, such as the ones performed in this region? I didn't hear. Could you repeat the question? What strategies are a priority to boost innovation projects for mitigation and adaptation to climate change, such as the ones that have been seen in this region? I think it is very important to facilitate the exchange of experiences, create environments where we can promote the work with different sectors and to learn of what's been done in other areas as well as this C40 Forum meeting that are municipalities working to deal with climate change, where they share experiences of what's being worked. I think that that type of environments needs to be replicated perhaps in different spaces closer to our region. This space, for example, could be one of them that could allow to collect and boost the experiences that are being worked in some areas and transfer them and improve them so we can apply them in other settings with the approach that they require, so you can involve all decision makers. Thank you. Thank you very much for your excellent interventions. And I would like to give us in 1 minute a final message about this topic. We will start with Dr. Hamilton.
Gracias. Creo como mensaje.
Well, as a final message,
dentro
it
de
is
todos
very interesting that in our activities we can add this vision of the concept of One Health, understanding that pathogenic diseases not only move between people and animals, and to add the environment, the conditions that we may have, and to think beyond of how some countries in the region are suffering the climate change effects, and how can this increase the interactions between the different subpopulations. That could be a message, and to promote research and collaboration and try to have free access to the different groups that can carry out these research activities. Once again, thank you very much for the invitation. Thanks to you, Dr. Hamilton. Dr. Gabriela Salmon. I'm going to follow on what Chris comment of sharing and translate the knowledge without barriers. Viruses and bacteria and the climate change effect don't know barriers, so knowledge shouldn't have limitations either. And a final message, I think that we always need to consider that we are part of this environment, and we need to take into account that everything we do is going to have a repercussion on health. I will ask you to get involved with your authorities, work that's being carried out, so we can get involved and commit to prevention, considering the impact that we've seen and that we are suffering from climate change, and also preventing any impact in the future that hopefully without a new pandemic. Thank you. I would like to once again thank our excellent speakers and to all the participants that week after week join us, to the Andean Health Organization team, and to all of those who participate in this activity that has been possible thanks to their commitment to Andean and Latin American integration. At this moment, I have the list of the participants from the Ministry of Health of Bolivia, Chile, Colombia, Ecuador, Peru, Venezuela, Navy Medical Center of Peru's Navy, the Peruvian Red Cross, the Piura National University, Trébol Azul Health Facility in San Juan de Miraflores, the Zoonosis Regional Service from Venezuela, the CMF from Ignacio Chavez, from Argentina, Bolivia, Chile, Colombia, Cuba, Ecuador, Spain, US, Mexico, Nicaragua, Panama, Paraguay, Peru, and Venezuela. All the participants, thank you so much for your interest in participation in this important session.
Para dar el cierre a nuestra reunión,
and to close this webinar, Dr. Marisela Malki has the floor on behalf of the Andean Health Organization Hipólito Unanue Agreement. Go ahead, Dr. Marisela Calle. Once again, my greetings to you, Dr. Gabriela Salmon and Dr. Hamilton, for your brilliant presentations. Go ahead, Marisela, Dr. Marisela. Thank you, Lucho. First of all, to once again thank our excellent speakers, Dr. Christopher Hamilton and Dr. Gabriela Salmon, for what they've shared with us during this webinar. And I think that this is the best way to emphasize our knowledge on regards of how should we approach health. What best way to talk about One Health. Health that in recent times has become an important and priority topic, unfortunately, because of the impact of the pandemic. Because before the pandemic, not everyone talked about health or consider health, but the pandemic led this issue to the center of conversation and policies. But unfortunately, now that we see that this pandemic is ending, we also see how we are losing that priority.
Gracias a las presentaciones hemos
Thank you to the presentations. We've learned that human health is not alone. It has a family, has an environment, and is interrelated with animal health and the environment.
Con la pandemia,
and with the pandemic,
hemos entendido eso.
we've understood that in the best way. It is also important to consider that health doesn't come alone, and the health sector is going to solve the health issues. By considering the social health determinants, this is a multi-sectorial approach. Health is impacted by different characteristics, different areas.
Y lo importante respecto a lo que hemos visto es adicional a lo que
in addition to what Dr. Hamilton has shown us, all the studies and the evidence that have been collected and presented, so our authorities and make the best decisions of how they approach it and to contribute in what is our role and responsibility. We also see how the political decision, the local decision can make the difference. Cases of Medellin and Iquitos. So it's extremely important in the context that we live in, where climate change and the increase in temperatures, the increase in greenhouse gases because of human actions is getting worse and worse. So it's important that the more local the decisions are made for that change, we'll be able to reverse the situation. In that regard, these presentations have been very important, and it's going to motivate that we can continue working, because it's going to depend on all of us who are convinced of this situation and problem to continue insisting that health should continue being the priority and be an important access for development, and the financing that we receive is an investment and not an expenditure. We already mentioned what means to invest in prevention in health is going to be reversed 1 to 10, and this is significant for the economy of our countries. And the other important thing that we've seen in this webinar, that the coordinated, harmonized response among countries and in countries, because we're not alone. Globalization has shown us positive and negative things. Unfortunately, the virus spread was extremely fast, and we had a pandemic like we never imagined before. So I think that reminds us that the best and the most cost-effective is always going to be prevention. And this is what we need to continue working in that regard. You've motivated us to think, to reflect, and to continue looking for new strategies and new partnerships to continue with this approach. Once again, thank you for your dedication in this webinar. We will share this at future moments, because we're going to continue to work in this topic with the Ministry of Health, Colombia, Chile, Peru, Ecuador, and Venezuela. And we're going to give what we hope to deliver our coming generations. We don't want them to suffer what we're going through. We should all contribute with this small of grain for a better world. And I would like to take the opportunity to invite you to the next webinar. Today is a day loaded this afternoon at 5 p.m. we have at Pan American Health Organization webinar to hear about the plans and programs of the new director appointed for Pan American. So we invite you all this afternoon at 5 p.m. Peruvian time to join us. Thank you very much. See you soon.
Muchas gracias.